Okay, Assalamualaikum and good evening to sir or madam. Okay, so my name is Muhammad Aiman and I will be presenting about my study case is bronchopneumonia. Okay, so first I will explain a little bit about what is bronchopneumonia. Okay, so I am from cohort DPY03. Okay, and I will start now. Okay, so first, for definition of bronchopneumonia, okay. Bronchopneumonia is the same disease as pneumonia, but it is affected at the bronchi, okay, at the lung. Okay, bronchopneumonia is a kind of pneumonia which they eventually become infected. Okay, because their airways are narrowed. Okay, people with bronchopneumonia may have difficult in breathing. Okay, their lung may not get enough of oxygen due to the inflammation reaction. Okay, and then the bronchopneumonia symptoms can range from minor to severe. Okay, an infection with virus or bacteria as well as other microbes, okay, has been the most common cause of the pneumonia. Okay, so that is for the definition of the bronchopneumonia. Okay, it is the infection of the lung at the bronchitis. Okay, so for the diagram of the lung, so we can see that on the left side, and okay, that is the normal lung, which is there's no any fluid, okay, in the alveoli air sacs. Okay, and then the lung with pneumonia, okay, you can see that the alveoli, okay, or the bronchioles, okay, are filled with the fluid, okay, or pus. Okay, so when we this is the picture when someone have bronchopneumonia of pneumonia. Okay, the pneumonia, okay, bronchopneumonia is the specific case, okay, which is affected at the bronchi. So if we say it is bronchopneumonia, okay, so that means the bronchi is affected and inflamed and there's fluid on the bronchi. Okay, so for pathophysiology of pneumonia, okay, we can see that from pneumonia they get pulmonary inflammation and then get mechanical ventilation. From that, there is 3 separate ways, and then they decrease the integrity of alveoli. Okay, and then they come across, and then they increase the circulating bacteria and pro-inflammatory cytokines. Okay, and then increase systemic inflammatory response. Okay, and then sepsis or multiple organ dysfunction. Okay, so that is the pathophysiological, and it is occur whenever virus, bacteria or fungus infect the alveoli, okay, or the bronchi. Okay, bronchopneumonia is a kind of pneumonia which the alveoli become inflamed, and because the airways narrow, people have been bronchopneumonia. Okay, so for sign and symptom, okay, okay, the patient will have fever, okay, a cough that brings up mucus, shortness of breath, okay, chest pain, rapid breathing, sweating, chills and headache. Okay, so for doctor management, okay, doctor will get advice to take medicine for specific cases. Treatment for bronchopneumonia is type of infection, okay, like severity, time of illness. Okay, and then bronchopneumonia usually clears up to 3 weeks for those who have any other health issue. Okay, so for several doctor will require the patient to do hospital treatment such as physiotherapy treatment or any kind of medication treatment. Okay, and then for the doctor will advise the patient to get some home rest or take any medication. Okay, so instead of that, doctor will also refer to you for further management towards the patient. Okay, so for physio management, physiotherapy will do chest therapy towards the patient who have this kind of disease, such as breathing exercise, percussion, postural drainage, vibration and suction. Okay, so that is for bronchopneumonia. And then for assessment, okay, I will continue to my assessment. Okay. Okay, so the patient name is Mr. Zack and his age is 6 years. Okay, gender is male, race is Malay, and the doctor diagnosed this patient have acute bronchopneumonia. Okay, so so for the patient complaint having difficulty in speed out of the sputum and cough gradually increase. Okay, and then for current history, okay, so current history, okay, on 30 January, patient father took him for a walk and there's open fire nearby. So that is the cause of the fire, cause of the bronchopneumonia, and the patient start to feel difficulty in breathing. Okay, on 15 January, patient father sent him to the KPJ specialist hospital because patient have shortness of breath and the condition getting worse, and the patient has admitted to KPJ SSH. Okay, and then on 16 January, the patient gets some treatment and referred to the physio for further management. Okay, I'm sorry, there's a little bit error over there. 16 January on 2022. Okay. So for subjective assessment, the past history, okay, on year 2020, that's mean 2 years ago. Okay, the patient have same problem and admitted to KPJ SSH. Okay, and the social history, okay, house type is single story and occupation is kindergarten student. Okay, he's just a kid. Okay, and then the house environment is residential and there's no renovation on his house. Okay, and then there's no allergy. He is not smoking. Okay, and then medication has been given convenient 1 AMP naps and bath makeup 1 AMP nap start and then sub PMC. Okay, and then IV Resopin. Okay, so for family history, past medical history, surgery history, and investigation is not in list. Okay, why? Because the investigation is not in list, because when I check the data about the patient, I didn't get any of the investigation that he might be do, so I didn't have that info. Okay, so for the objective assessment, general observation, a Malay boy with mesomorph body was sitting with his father and conscious and active. Branula is noted at his right hand. Okay, so for local observation, chest deformity is none. Okay, there's no the skin condition and color is normal, no clubby fingers, no cyanosis, and breathing pattern is normal breathing. Okay, and then for vital sign, okay, the temperature is 36.8 Celsius and for the oxygen saturation is 96 room air. Okay, for respiratory rate is 28 per minute and heart rate is 109 per minute. Okay, so for examination, okay, for auscultation, okay, I've been located the cracker sound at the right lobe. Okay, and then for examination chest measurement, okay, the ratio for the patient is 1:1:2. Okay, for apical is 1, the middle is 1, and lower costal is 2, which means that is not normal and reduced in muscle expansion at lower costal and middle. Okay, so okay, for examination chest expansion, okay, it is symmetry for right and left lung. Okay, so for objective assessment, okay, cough examination, it is effective and productive, which means the patient can cough easily and can produce the mucus easily. Okay, and then sputum examination, the patient spit out many sputum and amount is moderate and the color of the sputum is yellowish, consistency is thick. Okay, so the cracker sound for problem listing, okay, I have noted cracker sound at the right middle lobe, okay, and reduce air entry at lower lobe and middle lobe of the lung. Okay, so for short term goal, I want to clear out the secretion between 1 week and to improve air entry between 1 week. Okay, for long term goal, okay, to optimize the lung function within 1 month and to avoid secondary complications such as lung collapse. Okay, So for plan of treatment, okay, we might do postural drainage and percussion, vibration, deep breathing exercise, coughing, and home education for the patient. Okay, and then for intervention, okay, postural drainage and percussion, okay, aim to increase secretion mobility and to loosen up secretion. Okay, the procedure is patient in sitting position and lying position. Okay, when patient in the lying position, we will advise the patient to do left side lying due to his middle lobe at his right. Okay, all middle lobe is at right, so we need to do like left side lying. Okay, and then we will do it five times. Okay, I mean 5 times and 5 minutes. Okay. Oh, sorry, it is 5 minutes. Okay. Okay, so for coughing, aim to provoke the secretion, and then the patient will be in sitting position. Okay. The patient will be in sitting position, and we will do it in 5 times. And deep breathing exercise, aim to increase the lung function and breathing efficiency, and patient is in sitting position. Okay, and then for duration, it is for 5 times. Okay, and then home education, aim to prevent repetition case happen, and we will advise the patient parents to teach exercise and do percussion coughing technique at home for the patient, since he was child and cannot learn by itself. Okay, so for evaluation, patient feel relief and can easily cause a speed of sputum. Okay, and then the patient can breathe normally. Okay, and then for review, to review auscultation, and then to review chest expansion, and to review chest measurement. Okay, so that's all from me. Thank you.